Hello, good afternoon. Welcome and thank you for joining me. We appreciate you taking your time to be here for this broadcast today. Just had several things I wanted to go over with you today and sort of update you on what's going on in the department. We're very thankful you joined us, and we're very thankful the legislature has gone home. I mean, we are extremely thankful that they are. It's like Thanksgiving or Christmas. We're so thankful. When the legislature's here, it's quite a flurry of activity. We really stay busy trying to keep track of what's going on and stay on top of things. The legislature this year filed about 1,100 bills, and most of those don't have anything to do with us, but you don't really know that until you read them or until somebody reads them for me in most cases. And so we have a lot of things going on, a lot of balls in the air that you're trying to juggle at one time. So they went home for the end of the session this past Friday. They will probably be coming back in the fall. We hear in October for a special session related to prisons. Hopefully that won't affect us that much. We certainly appreciate the opportunity to work with many of the legislators. They give us the resources and the power to do the things that we do, but it's also kind of a challenge sometimes to help them understand the issues that we deal with. So it's a lot of nonstop action, and for now, hopefully it's a little bit of a reprieve. We felt like we had a very successful session with the legislature this year. The department actually had 5 bills that we were trying to push, and 3 of those were successfully sent to the governor for her signature. That's a great record, actually. Getting 3 bills through in one session is really terrific. I certainly want to commend Kathy Caldwell for her work in governmental affairs. You may know Kathy as our longtime CHIP director. She has just recently left the department for a promotion. She went to another state agency to rehab services, and we wish her the best and congratulate her on that job. But she certainly did a great job for us as in governmental affairs as well. She took that position on short notice, and we were really grateful to the energy she brought to that and to the real success that she brought to that as well. We were able to get some bills through this year related to our EMS Bureau, to our laboratory, and to one of our boards called the Licensure Advisory Board. These are all important things for us, and we appreciate her work on that and all the work of everyone in the department on that. So we're fortunate to have that finished and behind us. There are a lot of other bills out there that affect us in one way or another. If you have watched the news this week, then you have probably heard of the chemical castration bill. We're not sure entirely what to make of that yet, but it certainly affects us in a real significant way. At the moment, the governor is still making a decision about whether to sign that. So once that decision is made, we'll have more information and sort of know what role we have to play, if any, depending on the outcome of that. Probably the biggest responsibility, or the only major responsibility that the legislature has, is to pass the budgets. And so we obviously spend a lot of time watching that very closely because that has such an impact on what we do. For the most part, we were level funded this year compared to last year, with a few extra things. The biggest change this year for us had to do with the funding of CHIP. For the last 4 years, the federal government has picked up 100% of the tab for the CHIP program, and so starting this year, we had to begin paying our state share again, which is about 8% of match this coming year, fiscal 2020. And then it'll be around 20%, our baseline FMAP rate starting in fiscal 2021. That translates to around $24 to $25 million this coming year extra that we didn't need last year. Now, remember, we only get around $32 or $33 million total from the general fund for our entire health department, and yet we had to ask for almost $24 million just for CHIP alone this coming year. So, as you can imagine, that's a complicated ask. The legislature is very supportive of the program. I think they understand it and understand how important it is to the kids in our state, and they promised us all along they would take care of us, and they did. So we're very grateful for that. But certainly it's a big ask in a state that has a lot of budget needs. Next year, we'll be asking again for about a 20% state share, funding to pay the state share, and that may be upwards of $60 million depending on the enrollment in CHIP next year. So already we're trying to figure out how that's going to work out next year. There was a lot of debate this year about whether the general fund should pay for it or the education trust fund or where the money should come from, and that debate won't be settled in 6 months or maybe not even by this time next year. But we'll certainly have to find a way to do things next year as well. We continue to wait and see what's happening with the Medicaid and with their Coordinated Health Network plan, the ACHN plan. I think you're aware that they hope to implement that by October 1st. The truth is we really don't know the status of that. We have spent a great deal of time talking with Medicaid and talking with other folks here in Montgomery about what role we will play and about how that will play out. And at the moment, we simply don't know. We're not sure how that's going to affect us. The only, the only constant in life is change, right, as the saying goes, and so we continue to see change coming upon us fast and furious. It really has required a lot of creative thinking for us to think through just what we want to do as a health department. It's an exciting time in a way, to not just do the things that are mandated for us to do or do the things that we get paid to do, but actually think about how we want to serve our communities, to look at the public health needs in individual counties and towns and throughout the state and figure out where we can serve people best and what things we can do to help people the best. We know that we ask you all to do more with less. We know that all of you working, particularly in the counties, probably have fewer staff now than you had just a few years ago. You may have more responsibilities than you used to have. You may be covering more counties than you used to cover. We know many of you have more than one place that you work. I want to say, first of all, thank you for your dedication to the department in doing that. But most of all, thank you for taking care of the people of Alabama. We have a responsibility, but we also have a privilege to take care of the people in our state. And I am so encouraged every day when I get a chance to hear stories from people and meet with people who are out there doing that frontline work. So thank you so much for doing that. One good thing about the legislature going on, there are many, but one good thing is that we'll have more time to get out to the counties. And in fact, we've got some health department visits scheduled for tomorrow, and then we're working on some for July and August as well. So we continue to try to get around the state and try to get to see everyone as soon as we can do it. I really hope to do that in a year. We wanted to get to every health department in a year, but that's not quite going to happen. But we're going to get to everybody eventually, and we're certainly well on our way at this time. Just a couple of other updates for you. You may know that we continue to have a hepatitis A outbreak in northeast Alabama involving parts of the Northeast District and the Northern District. We now have 4 counties that we would consider as outbreak counties, around 65 to maybe almost 70 cases now of acute hepatitis A going back to September. This is a significant public health problem throughout the United States. It's been going on for almost 3 years now. Began on the West Coast, has traveled through the country, has been in Kentucky and Tennessee the last year, and then just moved into Alabama this past fall. We've been aware that it was coming. It affects, in this case, it affects groups of people that are really hard for us to get to in many cases. They're folks who are incarcerated, folks that are homeless, folks that have substance use disorders, drug abuse issues, and those are difficult populations to reach when we want to find them and counsel them or educate them or immunize folks who are contacts. Those are just tough people to track down. So we have some groups that are really doing terrific work trying to do that. I'm sure it's exhausting work. Everybody's overstretched. We are planning to recruit some teams of nurses who can do immunizations from our staff here in the tower. We're going to send them just like we would with an EP response. We're going to find folks who can go out and help with immunizations because it's really important that we try to get ahead of that and get it taken care of. Unfortunately, the other states in the United States that have had this so far have seen this go on for a year or sometimes 2 in some cases. So once it gets into a state, it tends to spread for a while, and it's real difficult to control. But we continue to do our best, and I want to thank the people who are out there doing that work. Finally, I wanted to mention to you something very exciting. Next week on Friday, a week from tomorrow, we are going to have a visit here in Montgomery by the director of the Centers for Disease Control and Prevention in Atlanta. The CDC director, Dr. Robert Redfield, is coming to Alabama to talk about an HIV prevention effort that you may have heard about. A few months ago, the president in the State of the Union address mentioned an initiative that's called Ending the HIV Epidemic. It's going to put out around $300 million to around 45 cities and counties in the state, as well as 7 mostly rural states that have a high burden of new HIV diagnosis, and that includes Alabama. So besides several large metropolitan areas, there are a few states in the southeast, including us, that are going to be eligible to receive some of this money. So Dr. Redfield is going to be here with his team from CDC on Friday. We've got a real interesting discussion group set up that morning with some public health folks from around the state. We're going to take him on a tour of one of our Ryan White clinics here in Montgomery called Medical Advocacy and Outreach, MAO, which has been involved in HIV care for many, many years now. They do terrific work, and we're going to go over there and let him see that facility. And then in the afternoon, we're going to come back to the tower and have another meeting in a roundtable format with a lot of the HIV providers in our state. The folks who are actually providing frontline patient care are going to have an opportunity to sit down with Dr. Redfield, talk to him about what they see in terms of HIV, and find out more about this Ending the HIV Epidemic program. So we're very excited about that. It's a great opportunity for us at ADPH to meet with the premier public health leader in the United States. So it'll be an exciting time for us. That's really all that I had prepared today. I'm happy to answer any questions if any of those have come in. I'll wait a minute and just see if there's anything else or any questions here in the room. But thank you again for what you do. We appreciate your service to the department and especially to the people in Alabama.